Every night, while your body rests, your blood sugar quietly keeps working, sometimes rising, sometimes falling. And for diabetics, that overnight roller coaster can silently raise your morning glucose, disturb your sleep, and damage your nerves, kidneys, and even your heart over time. But what if just one soothing drink before bed could help calm the storm? In this video, we're revealing three powerful nighttime drinks that can gently lower blood sugar, improve insulin sensitivity, and even support deep, restful sleep. So if you're tired of waking up drained or fighting stubborn sugar levels, stay with us. Your nights are about to change. Let's start with number one. 1. Chamomile tea. Chamomile tea may look like a simple herbal drink, but for someone managing diabetes, it can be a nighttime blessing for the entire body. This gentle floral infusion is more than just a sleep remedy. It's a glucose stabilizer, nerve relaxer, and blood vessel protector. Its effects are subtle yet profound, especially for those struggling with restless nights, blood sugar spikes, or diabetic nerve pain. What makes chamomile special is not just the warm comfort it brings to the mind, but the bioactive compounds hidden inside each flower that go to work silently while you sleep. And for seniors whose bodies are more sensitive to both stress and sugar fluctuations, this natural tea offers a deeply supportive role without harsh side effects. One of the key compounds in chamomile is apigenin, a powerful antioxidant flavonoid that reduces inflammation and supports insulin function. It binds to receptors in the brain that calm the nervous system, encouraging deeper, longer sleep, which directly improves overnight glucose metabolism. High cortisol levels, often triggered by poor sleep, are a hidden cause of early morning sugar spikes in diabetics. By gently lowering cortisol and promoting melatonin release, chamomile helps reduce the likelihood of these spikes. For diabetics who struggle to get a full night's sleep because of anxiety, hot flashes, or frequent urination, this tea acts as a natural regulator. Regular nightly use has even been associated with improvements in HbA1c, helping reduce the long-term risks of complications. Chamomile also supports nerve health, which is essential for diabetics facing neuropathy, tingling, or numbness. Its compounds work by calming overactive nerve signals and reducing oxidative stress that can damage small blood vessels supplying the nerves. It contains quercetin, another antioxidant that protects delicate nerve endings and reduces the low-grade inflammation that often accelerates nerve deterioration. In people with peripheral neuropathy, even mild calming effects can lead to improved sleep quality, reduced pain perception, and better circulatory function overnight. From a nutritional standpoint, chamomile is naturally caffeine-free, sugar-free, and calorie-free, making it ideal for a diabetic-friendly evening drink. Though it's not packed with macronutrients, it offers small but beneficial amounts of magnesium, calcium, and potassium, all of which play a role in nerve transmission, muscle relaxation, and heart rhythm stability. These minerals help reduce leg cramps, improve blood pressure control, and support hydration, which is often overlooked in diabetic care. The polyphenols found in chamomile also benefit the retina, helping to reduce the oxidative stress that contributes to diabetic retinopathy and vision loss. These same antioxidants are protective of the kidneys, lowering internal inflammation and easing the pressure on blood vessels inside the renal system. For diabetics prone to digestive issues, such as bloating, acid reflux, or slow gastric emptying, chamomile tea provides gentle support to the gastrointestinal tract. It relaxes the smooth muscle in the intestines, reducing cramping and promoting more effective nutrient absorption, especially at night when digestion naturally slows down. A calm, balanced digestive system helps reduce inflammation in the gut, which in turn supports better insulin sensitivity. There is a close link between gut health and glucose control, and chamomile can contribute to building a more resilient microbiome without needing supplements or fiber pills. Making chamomile tea properly is important to maximize these effects. Always start with filtered or purified water to avoid kidney-irritating minerals, especially in those with mild renal complications. Bring the water to a gentle boil, remove from heat, and add about 1 teaspoon of dried chamomile flowers or 1 organic tea bag. Cover the cup with a lid and let it steep for 5 to 7 minutes. Covering is essential because it traps the volatile oils responsible for the therapeutic effects. Never oversteep beyond 10 minutes, as this may release bitter compounds that can irritate the stomach lining in sensitive individuals. Avoid common mistakes like adding sugar, honey, or artificial sweeteners, which can ruin its benefits for diabetics. Even small amounts of added sugar can trigger insulin spikes at night. If you prefer flavor, use a tiny piece of cinnamon stick or a few fennel seeds, which are naturally glucose-friendly. The best time to drink chamomile is about 30 to 45 minutes before bedtime. This gives your body time to absorb its relaxing compounds and make a smooth transition into sleep. Avoid drinking it too close to lying down if you suffer from nocturia, as even a small cup may increase the urge to urinate during the night. The ideal dosage is 1 cup per night. Excessive consumption, especially more than 2 large mugs, can cause nausea, drowsiness, or digestive upset in some people. For those with allergies to ragweed, daisies, or marigolds, chamomile may trigger a mild allergic reaction like skin itching or nasal congestion. It's also worth noting that chamomile can interact with blood thinners like warfarin or aspirin, and it may enhance the effects of sedatives. So always check with your doctor if you're on long-term medication. Diabetics using insulin or sulfonylureas should monitor their sugar closely when starting chamomile, as it can gently enhance insulin action, which may lead to hypoglycemia if doses aren't adjusted. Chamomile tea also gently supports the cardiovascular system by reducing the tension in blood vessel walls, helping lower nighttime blood pressure. For older adults with both hypertension and diabetes, this is a welcome dual benefit. The natural vasodilation effect improves oxygen delivery to tissues overnight, which helps with healing, glucose metabolism, and nerve recovery. It may even reduce inflammation in the arteries, lowering the long-term risk of atherosclerosis, a common complication in poorly managed diabetes. If chamomile tea calms your nerves like a gentle lullaby, then soaked cinnamon water is your secret nighttime warrior. It's not just a spice, it's nature's quiet glucose guardian, working while you sleep. Curious how a simple stick can support your sugar control? Let's dive into this powerful bedtime remedy. Second, soaked cinnamon water. Soaked cinnamon water isn't just a bedtime ritual. For diabetics, it can be a quiet warrior working through the night to lower blood sugar, calm the body, and support long-term healing. While it may seem simple when used correctly, this drink taps into powerful plant-based compounds that gently regulate glucose, reduce insulin resistance, and protect the organs most vulnerable in diabetes. But to unlock its full potential, you need to understand the science behind it, how to prepare it safely, and how to avoid the common mistakes that can backfire. Let's walk through it step by step. With every drop, there's something valuable working in your favor. The main compound in cinnamon is cinnamaldehyde, which doesn't just give it a warm aroma, it helps improve how your cells respond to insulin, especially if you have type 2 diabetes. That means your body doesn't need to produce as much insulin to pull glucose from the bloodstream into the cells. As a result, soaked cinnamon water may help reduce fasting blood sugar, support lower A1C levels, and reduce the pressure on the pancreas. This matters even more at night when diabetics often experience unstable glucose levels due to natural hormonal shifts. What's impressive is how cinnamon slows the emptying of the stomach, which prevents sugar spikes after meals, even hours later. This effect is vital for diabetics, especially those who experience morning highs. Drinking soaked cinnamon water before bed may help reduce those spikes by stabilizing glucose overnight and supporting insulin function during sleep. Plus, it has natural antibacterial, anti-inflammatory, and antioxidant powers, all crucial for the diabetic body that's constantly battling low-grade inflammation and oxidative stress. Although cinnamon isn't packed with traditional vitamins, it carries active compounds that work like gentle medicine. A half teaspoon of Ceylon cinnamon, the preferred type, contains manganese, iron, calcium, and fiber in small amounts. Manganese plays a vital role in carb metabolism, while iron supports oxygen transport, which is critical for diabetic tissues like nerves and kidneys. But what makes this spice really shine is the presence of procyanidins and polyphenols. These antioxidants protect cells from long-term damage caused by uncontrolled glucose, especially in the eyes, kidneys, and nerves. Now let's talk about preparation, because this is where many go wrong. To make soaked cinnamon water properly, use half a teaspoon of organic Ceylon cinnamon powder or a small stick. Place it in a glass of room temperature water and let it sit for 8 to 10 hours. This cold infusion allows the bioactive compounds to leach out slowly, preserving their strength. Just before drinking, gently warm the water. Don't boil it. Boiling destroys cinnamaldehyde and other key antioxidants, reducing the benefit and sometimes even causing stomach irritation. Here's the mistake many diabetics make. They use cassia cinnamon, the cheaper type sold in most stores. Cassia is high in coumarin, a compound that can damage the liver if consumed regularly in large amounts. That's why Ceylon cinnamon is always the safer choice. Another error is adding sugar or honey. This cancels out the glucose-lowering effect and can cause a rebound spike. The best way to drink it is plain or with a touch of fresh ginger for added anti-inflammatory benefits and a calming bedtime aroma. The ideal dose is 120 to 150 milliliters, about half to two-thirds of a cup, taken 30 to 45 minutes before bedtime. This allows it to work gently through the night without interfering with digestion or medication timing. Don't go overboard. The safe upper limit of Ceylon cinnamon is 1 to 1.5 teaspoons daily. Higher doses can lead to low blood sugar, dizziness, headaches, or liver strain, especially if taken alongside medications like metformin or insulin. Soaked cinnamon water can be especially helpful for diabetics struggling with weight gain, fatty liver, or high triglycerides. By improving insulin sensitivity and reducing fat accumulation, it supports both blood sugar balance and cardiovascular health. It also acts as a natural appetite suppressant, calming late-night cravings, which often trigger nighttime blood sugar spikes and disrupted sleep. The benefits don't stop at sugar control. Cinnamon's impact on nerve repair and brain health is equally important. Diabetics often experience neuropathy due to glucose damage to nerve cells. Cinnamon's antioxidants may reduce that damage by supporting blood flow, improving oxygenation, and protecting nerve endings from oxidative stress. Drinking it before bed can help relax muscles and soothe irritated nerves, making it easier to fall asleep without that tingling, burning discomfort many diabetics face at night. Cinnamon water also supports the kidneys, which work harder in diabetics to filter excess sugar and manage electrolyte balance. Its mild diuretic effect may help reduce water retention without straining the kidneys, but only when consumed in proper amounts. For those with early signs of kidney stress or high creatinine, cinnamon's anti-inflammatory effects may help by reducing the burden of oxidative waste and easing vascular inflammation. Its impact on the heart is equally powerful. Cinnamon helps regulate cholesterol, reduces triglycerides, and improves vascular elasticity, supporting smoother blood flow through arteries that are often thickened or narrowed in long-standing diabetes. That means more oxygen to the brain, heart, and limbs, especially during the night when circulation naturally slows. This is critical for preventing heart attacks, stroke, or diabetic foot complications. For those managing high blood pressure, soaked cinnamon water offers an added bonus. Its compounds help relax blood vessels, improving circulation and reducing tension, a benefit that's especially important before bed when blood pressure should naturally drop. If it doesn't, the risk of nighttime cardiovascular events increases, especially in older adults with diabetes. Now, a quick word of caution. If you are on blood thinners like warfarin, cinnamon can intensify their effects. Also, if you're pregnant, have liver disease, or are on multiple diabetes medications, always consult your healthcare provider first. Cinnamon is natural, yes, but that doesn't mean it's risk-free when mixed with certain drugs or taken in excess. If cinnamon water gently whispers balance into your bloodstream, then apple cider vinegar steps in with a bold promise to push things even further. It's tangy, powerful, and surprisingly effective when taken the right way before bed. Ready to discover how this age-old remedy could help steady your sugar while you sleep? Let's explore. 3. Apple cider vinegar diluted. Apple cider vinegar might not be the sweetest drink you'll sip before bed, but for diabetics, it can quietly become one of the most powerful tools to bring down blood sugar, reduce insulin resistance, and protect the organs that are silently affected by diabetes over time. What makes this cloudy golden liquid so special isn't just its acidity, It's the rich profile of natural compounds like acetic acid, potassium, polyphenols, and the live probiotic enzymes in raw, unfiltered versions. All of these work together in ways that directly support the diabetic body, especially during the night when glucose control becomes harder due to hormonal shifts and slower metabolism. The key active compound in apple cider vinegar is acetic acid, and research shows it helps reduce post-meal glucose spikes by slowing down the breakdown of carbohydrates in the stomach. That means sugars from your dinner or late-night snack enter your bloodstream more slowly, helping prevent the blood sugar roller coaster many diabetics experience overnight. For people with insulin resistance, acetic acid improves how muscles respond to insulin, so your body needs to produce less of it, a huge win for reducing the strain on the pancreas. A tablespoon of raw, unfiltered apple cider vinegar contains small amounts of potassium, which helps balance sodium levels, supports nerve function, and promotes heart rhythm stability, something diabetics often struggle with as complications grow. It also contains trace minerals like calcium, magnesium, and phosphorus, which together support muscle relaxation and metabolic stability, especially helpful if you deal with leg cramps, neuropathy, or blood pressure spikes at night. What sets apple cider vinegar apart for diabetics is its effect on the liver. The liver is the backup organ for blood sugar regulation. At night, it releases glucose to maintain your energy when you're not eating. But in diabetics, this release is often too aggressive. Apple cider vinegar helps suppress this excessive glucose dump, leading to better fasting blood sugar in the morning. Many users report seeing a drop of 10 to 20 milligrams per deciliter in morning readings after just a few weeks of consistent use. Another quiet benefit comes from the natural probiotics found in raw vinegar, especially the type with the mother, that cloudy sediment floating at the bottom. These are live enzymes and friendly bacteria that improve gut health, which is closely tied to insulin signaling and inflammation control. A healthier gut supports better digestion, smoother metabolism, and less internal stress, all of which matter when trying to heal from diabetes at the root. For preparation, the right way is simple, but must be done carefully. Add 1 teaspoon to 1 tablespoon of raw, organic, unfiltered apple cider vinegar to 1 cup, 240 milliliters, of lukewarm water. Drink it 30 minutes before bed on an empty stomach. If you're new to vinegar, always start with just 1 teaspoon and observe how your body reacts. Do not take it straight. The high acidity can damage tooth enamel, irritate the esophagus, or upset your stomach lining, especially in diabetics who already have gastroparesis or acid reflux. One of the most common mistakes diabetics make is mixing vinegar with juice, honey, or artificial sweeteners to improve the taste. This defeats the purpose by adding unnecessary sugar or triggering gut fermentation. Instead, you can add a few slices of fresh cucumber, a bit of mint, or a dash of cinnamon powder to mellow the flavor without changing its therapeutic properties. Another mistake is using pasteurized apple cider vinegar, which is clear and shelf-stable, but lacks the probiotic-rich mother. Only choose raw, cloudy, organic brands for the full benefits. And never mix vinegar with medications without checking with your doctor. It can interfere with diabetes drugs, potassium-sparing diuretics, or insulin therapy, especially when taken in high doses or without food. The ideal dosage is 1 tablespoon diluted in water once daily, preferably before bed. Avoid exceeding 2 tablespoons per day, as overconsumption can lead to hypokalemia, low potassium, worsen gastric irritation, and in rare cases, cause bone loss or delayed stomach emptying, especially in people already dealing with nerve-related digestive issues. If you notice cramping, burning, or bloating, reduce the dose or stop for a few days. Apple cider vinegar also supports cholesterol balance, something most diabetics struggle with. Studies show it can help reduce LDL, bad cholesterol, improve HDL, good cholesterol, and lower triglycerides, all of which ease pressure on the heart and blood vessels. This is particularly important at night when circulation slows and your body enters repair mode. Having stabilized lipids during this time supports long-term healing and protects from silent cardiac damage that's so common in diabetics. This drink also supports weight loss, which indirectly improves insulin function, reduces fatty liver, and lowers inflammation markers. Its mild appetite-suppressing effects may also prevent late-night cravings, which often sabotage diabetic control. For those who struggle with restless sleep due to high glucose or constant urination, apple cider vinegar's blood sugar balancing effect can gently stabilize nighttime metabolism, making rest deeper and more restorative. For people who wake up frequently to urinate, diluted vinegar may help reduce sugar spillover in urine, ease inflammation in the bladder, and promote deeper sleep by stabilizing overnight glucose. And if your nerves feel jumpy, your sleep is broken, or your body feels inflamed, this one small drink might calm those hidden triggers quietly, night after night. On a broader level, this drink affects multiple systems in the diabetic body. It calms the nervous system, reduces oxidative stress, supports kidney filtration, improves vascular tone, and nurtures the gut-liver-pancreas axis, which is often out of sync in people with high blood sugar. In other words, it doesn't just target symptoms. It touches the whole network that drives diabetes from within. If you found these nighttime drinks helpful, don't forget to like, comment, and subscribe to stay updated with more simple tips for managing diabetes. Share this with someone who needs peaceful nights and healthier mornings, and let's take control of blood sugar one sip at a time.